Hi, my name is Ann Herleth, Vice President of Member Insights at the Health Management Academy. Today, I'm diving into something I've been eager to share with you all: what our research collaborative is actually seeing from early AI pilots in nursing care delivery. Now, before we jump in, just a quick note about some of the data I'll talk about today. Across the last year, my team at the Health Management Academy has conducted analyses and really looked at health system pilots who are focused on AI solutions specifically for bedside nursing in the acute care setting. We've looked at what they're focusing on, how their staff are responding to those pilots, and most importantly, what their outcomes to date have been. So I want to share some of that information with you today because AI in nursing is critical. And it really boils down to two things that we need to figure out. One, nursing workload, and two, labor costs. Starting on the cost side, our data show that labor costs are climbing from 52.5% of operating revenue in 2021 to nearly 56% in 2023. And on the workload side, if you've been following our research or you are a nurse leader, any type of clinician, any type of healthcare leader, or you simply know one, you know that acute care nurses in particular have an unmanageable workload, and that unmanageable workload is leading to higher rates of turnover and even some conversations among organizations like labor unions. So nursing has what I think of as a vicious cycle. We have high levels of turnover driven by heavy workloads, very acute patients, and stressful work environments. That leads to more burnout, more departures. We see vacancy rates go up. We see turnover rates go up. We, at times, need to spend a lot of money on agency nurses. And that inflects those labor budgets. And it seems like over and over, we are running after one or another. And so the stakes really couldn't be higher in nursing. We need to create bedside roles that people want so that they're willing to not just work in them, but stay in those roles over time. So that brings me to the major opportunity of AI in nursing care. And when we think about what could best be inflected to change nurse workload in particular, I think we all run to the documentation burden. And I get it, and I'm right there with you. I know that documentation can take up to 35% of any nurse's time. And that really translates to 3 or 4 hours of a 12-hour shift on charting. Things that could be better allocated and time that could be better allocated to direct patient care, to training, to development, you name it. But there's something important I want to understand, because while I have a lot of enthusiasm about what's going to happen with AI-enabled documentation, companies like Abridge and Nuance and their health system partners are really in the pilot stage of these documentation solutions. And those pilots are ongoing. We are tracking to them, and I'm really excited to eventually share outcomes and information about how nurses have reacted and put these AI tools into place and into practice. But until we have measurable outcomes, I really want to hold on unpacking that opportunity. So instead, today, I want to share real impact we are already seeing from AI-driven solutions. And honestly, these opportunities aren't really getting the attention I think that they deserve. Take WellSpan Health's work on reducing response time to patient deterioration. They implemented an ambient monitoring system that uses AI to identify when patients are at risk of falling. These sensors are in the patient room. They track movement. They alert nearby clinicians when a patient is getting out of bed or when they're otherwise at a high risk of falling. When I saw the numbers that I'm about to share with you, I was honestly shook. They are truly impressive outcomes that I do not know how you can get to without some type of technology or AI support. So here they are. WellSpan Health saw a 52% reduction in falls, a 92% reduction in sitter hours, and an 86% of nurses reported improved or greatly improved safety on their unit. That is incredible. And if you break down what that means in practical terms, patient falls are among the most common hospital-acquired conditions, and they affect nearly 2% of every hospital stay. So each fall with injury can cost a hospital up to $14,000 in additional care and extends length of stay, usually by at least a few days. By reducing falls by more than half, WellSpan not only improved patient outcomes, but they are also significantly reducing the associated costs with those. So amazing outcomes, just looking at the three I mentioned. But here's what I found really interesting. These outcomes are really just the beginning of what inpatient ambient monitoring capabilities can look like. In the future, the exact same hardware that's already in place could power functionality like monitoring for pressure ulcers or alerting security to escalating safety situations, and they're not going to require any further staffing. So that's one, my first example for you on the way that AI is right now impacting the way nurses are delivering care and having incredible outcomes for patients. Another area that is showing promise when it comes to AI-driven solutions is an unexpected one, and that's around nursing education. Emory Healthcare partnered with Impact Advisors to develop what they call MChat, an AI-powered chatbot that helps nurses quickly find policies and protocols. Now you might think, okay, chatbots, not the most interesting thing in the world, but I want you to hang with me for a second here. Before MChat, their nurses were spending up to 45 minutes trying to locate policies, and they often ended up with outdated information because, of course, they're going to turn to their peers, to their managers. They're getting information through word of mouth. With MChat, nurses are seeing at least 15 minutes saved per task. But more importantly, we know that the nurses are getting the right information when they need it. The system is even taking this one step further by leveraging MChat not only to proactively identify discrepancies in policies between their sites of care, but really scaling what this looks like across the organization. This is a particularly valuable thing to think about in large health systems that have grown through mergers and acquisitions. Systems that have 5 or more hospitals typically have an average of 2.5%. The system is even taking this one step further by leveraging MChat to proactively identify discrepancies in policies between their sites of care. You could imagine something like this being particularly valuable for large health systems that have grown through mergers and acquisitions. These inconsistencies can create confusion, compliance risks, and potential patient safety issues. So MChat is not only providing faster access to information, but helping to standardize care across a system. The reason I'm highlighting these examples is that they represent something crucial. Opportunities where AI can make an immediate difference while we wait for some of those more complex solutions like clinical documentation to mature. These aren't just pilot projects anymore. They are real, they are measurable improvements, and we're seeing it both with nurse satisfaction and patient outcomes. So as we wrap, I want to make an ask of everyone who's listening. Wherever you decide to focus, I want you to think about 2 things. One is, how can I be leveraging AI right now to drive change when it comes to the work that nurses do day in and day out? And then the second, and importantly, is how do I protect nurses while they are testing these AI solutions? Because the reality is that we are in a very experimental phase of AI in healthcare, and we need to be thoughtful about the implementation. For example, HCA Healthcare recently codified AI protections in their union contract. And whether you are unionized or not, I think their framework offers a really smart roadmap for all of us. Let me break down the key elements of that right now. First, they established clear protocols around quality control. Every AI output requires human review to ensure accuracy. It sounds obvious, but having these formally documented, it matters. They also put in place mandatory trainings, and these aren't just initial trainings, but annual refreshers and role-specific modules to ensure everyone understood what was going on. And here's something I particularly appreciate. They included protocols for reporting when something doesn't go right. Most importantly, though, they created formal channels for nurse input throughout the process. Because what we learned from WellSpan and Emory's pilots is that nurse involvement in development and in implementation was crucial to their success. When my team ran focus groups last year with nurses talking all about AI, we consistently heard that they want 2 things: transparency about how these tools work and clear processes for raising concerns. As one nurse put it to us, I don't mind testing AI, but I need to know that there are guardrails in place. And so it seems fitting to end today's podcast with the Frontline having the last word. I hope this gave you at least somewhat more of an expanded perspective on how AI can impact nursing care right now. And I look forward to sharing more updates as we watch some of these pilots and other ways that AI is supporting bedside nursing mature in the coming year.